Hello, everybody. Thank you for being here. I want to start with a very bad statistic. More than 71% of US patients with critical limb ischemia got amputations without ever getting any vascular intervention. I'm Georgi Kudra from Caring Health, and our mission is to make preventable deaths and suffering from conditions like limb ischemia think of the past by applying our solution based on thermography and AI for very accessible vascular diagnostics. We started the team 4 years ago with very diverse experience in machine learning, AI, medical science, and venture building. And our efforts to build something very accessible for PAD diagnostics have already been recognized by organizations like Novartis, Roche, EIT Health. So Kelvin Health actually started as a spin-off from Imaga, one of the pioneers in visual image recognition more than 12 years ago. We've processed more than 30 billion images for hundreds of enterprise customers across the world. And we've been recognized as an innovator by IDC, by the European Commission, and got a solid amount of grant funding. But Kelvin Health appeared as a very personal venture to us, as it happened as a set of serendipities around the health of ourselves and our loved ones. In 2018, in the summer, shortly before my son was born, my father-in-law, Hugh, nearly lost both of his legs because of late diagnosed peripheral arterial disease as a result of his diabetes. And unfortunately, he's one of the more than 200 million patients who got to the vascular specialist so late that more than 20 million, which is above the average population of a whole European country or the state like Florida, develop critical limb ischemia. This is a condition that first takes your limb, then is still very likely to kill you in less than 5 years. We believe that this problem is rooting in multiple factors, and one of them is the lack of vascular specialists. The other is the lack of accessible and precise non-invasive diagnostic methods, and in general, the availability of invasive and expensive methods like X-ray angiography. So we started thinking, can we build a solution that assists in the rapid triage process, in the clinical decision-making process of the specialist, and at the same time is cost and time-saving, and ultimately limb and life-saving for the patients. So we decided to combine our experience in visual AI and built a very patient-friendly diagnostic solution where basically using a portable thermal camera like this one, we can capture the heat of the body, segment the different thermal zones, detect local blood flow anomalies, and notify whoever is the examining specialist or clinician. This is different from other modalities of imaging and AI because it's very portable, and also there are no pre-existing data sets from a competitive standpoint. Last but not least, there are no predicate devices currently on the market with the FDA, for example. So the whole concept of mobile thermography and AI is possible because our local body temperature is directly related to our blood flow, and there's a limited amount of factors that can affect it, such as inflammation and blockage. If we can collect enough samples and train machine learning models, we can achieve a very precise diagnostic process, actually in multiple therapeutic areas. However, we decided to focus on vascular conditions first, and here's how the solution works for scanning your legs, then detecting the different arterial zones and the level of perfusion problems in each arterial zone. This is how our software automatically segments the images and detects the perfusion problem in each of those zones, and these are real screenshots from our software. So together with the medical team of Professor Ivo Petrov, we repeated this experiment more than 11,000 times, obtained more than 11,000 thermograms from 1,500 patients, and we witnessed very high precision, both in terms of detecting the problem and its locality that can be matched with the very invasive X-ray angiography. So we started working with multiple other specialists and providers across the world, and we witnessed a lot of excitement about Kelvin Health's impact, even during its current research phase. 9 months ago, we also started conducting interviews with US clinicians, and something that we spotted as a very interesting concordance was that they see the application of this not just in specialty vascular care, but also in primary care and podiatrists in emergency response cases where the time for diagnostics is of a very strong importance. So currently at the preclinical stage, practically repeating our feasibility studies from Europe currently to the US, engaging with multiple partners. And after we got FDA clearance, we want to start by offering this as an assistive diagnostic solution in the hands of the specialist and the vascular care team. But then we also want to expand to primary care, basically as a specialist agnostic or user agnostic tool that can empower very wide screening. And last but not least, we also want to empower the patients to have the benefit of precise, rapid remote monitoring in the comfort of their homes when this is needed. Even assuming that we use this solution just in the hands of the specialist and just for the therapeutic area of vascular disease and PAD and CLI in particular, gives us more than 800 million of serviceable addressable market if we assume $50 per examination session diagnostic as a service business model. So what's current for us, as I briefly said, is repeating the feasibility studies that we did in Europe, in the US, then preparing for FDA breakthrough designation and de novo or PMA applications, grant funding some of our research so we can reduce and mitigate the risk for investors, and ultimately starting a preemptive EHR integration and talks with payers so we can scale the solution further once it's validated. To speed up this process, we're currently raising $4.8 million US. More than 1/3 of it has actually been already soft committed from various investors in Europe, and we are working with multiple acceleration programs, some of them completed, some of them ongoing currently here in Europe. So if you also believe that a true unicorn company should positively affect the lives of billion people, we are happy to discuss how we can do this together. And one interesting opportunity, if there are representatives from healthcare providers here, is that we're currently applying for PCORI funding by the end of this month with a budget of 22 million for feasibility and then clinical validation phase. Thank you.